Well, with it being so near Halloween, I thought I'd have a little fun today and talk about carpal tunnel, and I brought my trusty little extra hand to help with that process. Carpal tunnel is a condition where individuals who utilize their hands quite a bit, whether it be sitting at a computer, whether it's turning wrenches on an automobile, cause a thickening of this ligament, this retinaculum that goes on the palm surface of the wrist. When that happens, that causes the bones to get pulled together a little bit more closely. The tendons that pass through the wrist area here, that cause the fingers to move, then rub up against the bones, get inflamed, put pressure on the nerve, and the person experiences either numbness and tingling. Eventually you can get to a point where there's pain, and ultimately can get weakness in that extremity. Typically these conditions are initially treated by anti-inflammatories. Sometimes there's steroid injections given to try to get rid of the swelling, and ultimately the condition is treated via surgery. This of course is on the medical model. Chiropractically, we look at trying to alleviate the problem by expanding the space here, by working with this living tissue that can be changed. It's dynamic tissue, and try to get in here and adjust the bones, stretch out this retinaculum that is the culprit, and relieve the pressure on the nerve, thereby relieving the condition. There's also a host of other areas that you have to work. You have to work with the extensor muscles in the forearm, the flexor muscles in the forearm, and support the person by giving them some exercises and stretches to bring the condition around. Now, not all conditions are relieved by chiropractic care. Sometimes the condition has gone too far and surgical intervention is needed. But in many of the cases, before it gets to that point, if a chiropractor were to take on the case, you can relieve the condition. So if this is something that's afflicting yourself or a friend, family member, suggestion to get into a chiropractor and get properly evaluated to see if this is a condition that can help. Might save them some needless suffering. Thanks.